Alrighty, so now we're live. Hi, everybody. Thank you so much for joining us tonight. Today we have two amazing general dentists. We have Dr. Nick and Dr. Justin, and they're going to be talking about general dentistry today. So thank you guys so much for joining us.
Thanks for having us. So we did a similar presentation for University of Virginia students who are in pre-dental, and Justin and I made some modifications to it to be a little bit more specific to kind of what it feels like to be shadowing in an office, so you guys can hopefully get a little bit more of that feel. We did those modifications today, so forgive us if there's a few typos or anything in there, but hopefully you'll get something out of it, and hopefully it'll be beneficial. So a little background on both of us first. I'm Nick Minutella. I always knew I was interested in healthcare, but I didn't know specifically dentistry at first. I went to University of Virginia as an undergrad, and I have a BS in civil engineering. I knew I didn't want to major in any of the health sciences that most people do to get to dental school. I got some minors in chemistry and business. I studied abroad in Italy. I almost had a minor in Italian. Basically, my point in saying all that is major in what you want. When you get to dental school, that's what's going to be your career path. That's when you're going to learn the things you need for life. So learn the things you want to learn. Broaden your horizons a little bit, kind of enjoy your experience in undergrad. I went to the University of Maryland Dental School and worked in the Baltimore area for two different practices, part-time in each. So I got a better sense of different management styles, different patient bases, different ways of working, which really helped me choose the practice that I ended up in long-term. After moving to Charlottesville as an associate for 6 months, I purchased the practice I was working in. And then 5 years later, I purchased my second practice about 12 miles from the first one. And so I'm currently owning two, and Justin is my associate in the Charlottesville practice.
Cool. So my story is not too far off from Nick's. I always wanted to practice medicine and work with my hands. So from the beginning, I wanted to do some form of surgery or dentistry. I actually was taking my MCATs and ready to submit my medical school application when I realized, hey, I hadn't shadowed a dentist, and I did, I think, a week of shadowing and was convinced that dentistry was for me. I'm also a UVA undergrad. I did a kind of the more traditional path. I was a BA in biology. From there, I went to the University of New England. So that was up in Maine, East Coast, Portland. And it was great. I picked that school because I really enjoyed the last year. I actually didn't even step foot into it. I did 4 3-month externships. So much like Nick working part-time in 2 practices, I spent 4 separate 3-month rotations in different kind of working situations. But 1, to better learn dentistry, but 2, it really kind of opens your eyes as far as like the type of dentistry that you can practice. And after dental school and living up north, I moved back to Charlottesville and joined Nick at Charlottesville Blue Ridge Dental, and I'm the associate. So I'm sure you guys, everybody wanting to be a dentist knows a little bit about the school, but I'll kind of break it down for you. So typical arrangement of a dental school program is your first year is very academic focused. So there's some dental kind of work mixed in there, some lab work. You're practicing on basically a giant mannequin with a terrifying mouth. Year 2, it's heavy dental specific academics. So you're learning kind of all of the nitty gritty aspects of what dentistry has to offer. More simulation work, really trying to work on kind of the hand skills in order to get you ready for practicing on patients. At the end of year 2, you take part 1 of dental boards, which focuses on all of the academics that you've covered. Year 3 is clinical focus, most of the time spent upstairs or in the clinic, essentially working on actual patients. You learn kind of hands-on at that point with some classrooms still. And then last year, like in my case, it was all clinical. So I was essentially an associate, just not getting paid as part of kind of your 4th year of dental school. And that at that point, you take part 2 of boards, which is really focused on the dentistry and the hands-on aspect. So written obviously is on the academics. Patient-based, you actually have to get your own patients, bring them in on test day, and go through the testing process. But each school is different. Nick and I kind of look back at our programs, and there's some variation between the two. So post-dental graduation then sets you up for private practice. That's what I did. I felt ready. School had prepared me well enough that I was ready to kind of dive right in. Some states actually require a residency, Delaware and New York being the ones, and they have things that are GPRs and AEGDs. Nick, you can correct me if I'm wrong on this or if I mix it up, but the GPR is basically a dental school, correct? And then the AEGD.
Other way around.
Other way, okay. GPR is hospital-based. AEGD is your basically like doing a 5th year of a dental school program. And then you have your specialties after that. So everything from oral surgery to endodontics, and they range anywhere from 2 to 6 years. So factors to consider in choosing a school. Cost is kind of big. Mine was a private school, so I paid an arm and a leg, and we'll be paying off student loans for quite some time, but I thought it was worth it. If you can get into a school and you like both schools and one's cheaper, you're kind of doing yourself a favor by saving a couple bucks. Technology was huge for me as far as my pick. I went to a brand new school. I was the second graduating class. So we were basically having the best of the best. You have to look for things. What type of charts are you working with, all digital or paper? What type of teaching do they have? Are they making sure everything's up to date? Are you being taught by faculty who's academic? Or are you being taught by people who have actual clinical experience coming from the private practice world? Do you share time with med school? For mine, I actually spent 8 to noon essentially doing med school classes for the first year. So you're kind of going through all of that and then having to do dentistry in the afternoon. What type of patients are you working on? Where you get them from? Do you have to get them yourself? And then lastly, the outside opportunities, which was huge in my case, is externships. I learned basically working for an entire year, and from people that I've spoke with, that was a better experience than a year of a residency program. So you got to kind of figure out which one's better for you. So general GP, so your general practitioner, you do what you want to do, you see who you want to see, and you refer out. So if you have a patient that's a complicated case that you don't enjoy doing that type of dentistry, you don't have to do it. You can send it to someone. You see everyone, all ages. I mean, I think I've seen patients as young as 2, maybe even a little bit younger, and I've seen patients that are rounding out right around 100. So you kind of get to see everyone, all conditions, all procedures. And Nick and myself, we really like doing it all. So, I mean, we can do everything from implants to fillings to root canals to crowns to extractions to really kind of whatever you want to focus your practice in on. The biggest thing is if you do those things, you have to make sure you're doing to the same standard of care as a specialist. So you can't be doing a job, doing an implant and have it go poorly because you don't know how to do it. You have to be able to have kind of the education and practice to be able to say, hey, I can do this the same way an oral surgeon would, or the same way an endodontist would. But ultimately it gives you flexibility, variety. Unfortunately, it does give you the lowest average financial reward compared to specialists, but you got to do what you like to do. So these are just examples. I'm sure you guys have probably seen stuff like this, but for instance, kind of your what they call bread and butter dentistry is your hygiene exams, your fillings, your crowns, extractions, and emergencies. So on the left, you see a filling, moving the cavity, getting it filled. On the right-hand side, you see a crown where you shave the tooth down, put either a porcelain ceramic or gold or some material, essentially crown, on top of that tooth to protect it. This is an example, not one of Nick and I's case, but just one that we found online that kind of shows you what you can go through in just 1 days of dental work. That person went from having a mouth that looked like that first image to having most likely temporaries in that second one to a final product that's just going to be life-changing. That person probably never wanted to smile beforehand, and afterwards, I guarantee you, aside from COVID times where you have to wear a mask, they're probably wanting to show off that smile as much as possible. So careers in dentistry, I know you guys you're getting kind of talked to by other specialists, but one of the reasons that I like GP versus specialist is a specialty, you're locked into that responsibility associated with that specialty. You can't practice outside of your specialty. You must market and network to gain referrals, so you kind of have to schmooze with everyone. As a general dentist, you get schmoozed too, which is kind of nice. As the specialist, you're the one that actually has to go out and get referrals, make sure that you're staying connected with all the dentists because they're the ones sending you patients. Your patient pool's smaller, and a lot of times you don't get a follow-up with them. You see them for like a one-off procedure, and then they go back to their general dentist. So you don't really know how things turned out. And then ultimately, you have more complex procedures, which typically means increased liability, but then in the end, also a higher financial reward. So you have to kind of really figure out what you think works best for you and kind of what suits your lifestyle that you want to have.
I'll also add in there, Justin, the more complex procedures is not necessarily a bad thing. If you really love doing root canals, then you should be an endodontist because you're going to see all of the nasty root canals that nobody else wants to do. And that can be fun if you really like it.
So just a kind of brief overview. So oral surgery, they do everything, they're facial surgeries. An oral surgeon, fun fact, in a hospital setting actually replaces a plastic surgeon and an ENT with the amount of knowledge that they have of the head and neck. So they do everything from your tooth extractions to implants to jaw repositioning for orthodontics, where they break the jaw and move it around and drill it back into place. They do grafting and bone surgery, reconstructions from traumas, biopsies, and removals of oral pathology. But keep in mind, as a general dentist, Dr. Nick and I, we do tooth extractions. Sometimes they are a little complex. We do implants, we do bone grafting, we do some minimal bone surgery, but that's kind of where we stop. So we don't necessarily, if we have something that's too advanced, we have wisdom teeth that are coming in at weird angles, we don't have to do that. We send it off to the oral surgeon, or we're kind of done with it. Endodontics, like Dr. Nick was just talking about, all they do is root canals. Root canals, root canals, and root canals. So they do, the only other kind of thing that they mix in there is what's called an apicoectomy, which is a surgery where you remove that top end of the infected tooth of the root, and then you suture and bone graft that closed to help a lot of times with failed root canals. Some are starting to place implants, but not many. And normally they only get to have 1 or 2 visits with the patient, and then that's it. Periodontics, so they're the gum specialists. They focus on our connective tissues. They do the recontouring surgeries, the gum and bone grafting. They do implants as well, and they're very focused on kind of the pink portion of the mouth. They focus on that gum tissue and their treatment, and they also do chronic disease, which is periodontal disease. So they get to really kind of focus in on that kind of portion of dentistry. So much like an oral surgeon's focusing on the tooth and the bone and that, the periodontics is focusing on the gum and kind of the supporting structures there. Prosthodontics, those are the people that we refer to for difficult restorative cases. They do dentures, cosmetic cases. If you have a patient that is beyond picky, you know, you want to send them to a prosthodontist because they have the ability to utilize labs, or sometimes they even have master ceramists in their office that can make a tooth from scratch that looks like a piece of art. They also do full mouth rehabilitation. Somebody that's never taken care of their teeth wants to have everything done all at once. A prosthodontist typically will do that, or a complex bite alignment. They're the ones that kind of take on those puzzles of dentistry. So they not often the most easy things. They also have a lot of kind of stumbling blocks along the road, but those are the ones who typically take care of the things that general dentists and some specialists don't want to necessarily or have the know-how to do. Orthodontics, they do tooth alignment. They do braces, Invisalign. They move teeth for cosmetics, function, health, sometimes TMJ, your joint pain. And they also will consult sometimes with oral surgeons for those jaw surgeries to reposition, because sometimes you can only move a tooth so far and you have to do some surgery in order to help move the bone and the teeth all at the same time. And then pedodontists, they do children and adolescents. They diagnose and treat. They do a lot of behavior management, a lot of patient and parent education, because a lot of times the kids aren't able to take care of themselves. So you really have to work with parents to help teach them to take care of their children. A lot of it's prevention focused, because if you think about it, you have baby teeth, they only have to keep for so long. So they're trying to focus on, once those baby teeth are lost and you have your adult dentition coming behind, really keeping things clean from the onset so that you don't have to see them in your chair to fix things. And a lot of it is also growth and development monitoring, making sure teeth are coming in when they need to, making sure kids are growing is the way that they need to, and they intervene when something's off or when they need to.
I want to add to the specialty section in general. The reason we kept this in here, I know you guys are having presentations from many of the specialists, is because all of this is applicable to general dentistry. Justin touched on it briefly. There's very few things in these lists that we don't do. We do extractions. If an extraction looks harder than we want to get into, or like it might be too much liability compared to the reimbursement we get for it, then we'll kick it off to the oral surgeon. But we do extractions weekly, if not daily. Root canals, there'd be some weeks where we feel like endodontist office because we have 4 or 5 root canals on the schedule. We do orthodontics. I mean, we do gum grafting like periodontists. So we do virtually a little bit of everything. And so that's one real nice benefit of being a general dentist. You get a ton of variety.
So types of private practices to work in. So you have a lot of flexibility in how you practice when you are in private practice. So I'm an associate dentist. So my main focus during the day is day-to-day dentistry. I go to work, I do what I need to do, and then I come home. So I don't necessarily have to take my work home with me. And it's fairly low or minimal risk. As the owner dentist, like Dr. Nick here, he has to do the dentistry. He then has to manage the practice and the financials. He's responsible for the staff and the HR and who's upset who and this, that, and the other, and making sure patients are happy with staff and all of that.
And now who needs a COVID test when?
Exactly, yeah. Somebody's got a runny nose, now they have to go get a COVID test. And when do we do that? And somebody's kid sick, you have to be able to staff the office so that we can work. Nick has increased liability over me, increased hours. He takes his work home. You can't fit this into a work day when you're seeing 10, 15 patients or more. But Nick also makes more money than me. So definitely an incentive to own, or in my case, eventually partnership, or buy Nick out when he wants to retire at a young age because he's made all his millions.
I wish.
So the next thing, so when I did my externships, I worked in a couple things. So one of these was a health clinic. They're typically either hospital-based clinics or a rural health clinic, or an FQHC. FQHC stands for Federally Qualified Health Clinic. They typically serve like a lower income patient base. It's often very rewarding because the type of patients that you work with don't typically have access to medical care or dental care. So they're very thankful for the work that you do. Sometimes you're limited in the amount of dentistry that you can do because you're limited by what you have time for and the materials to do. So in my case, and one of the places I was at, I was only able to fill teeth, pull teeth, or make dentures. So if they needed anything else, they had to go somewhere else. Some clinics or states offer loan repayment programs as an incentive, because a lot of them are either in not so desirable areas or in very rural, remote areas of the state. Great opportunity to get your feet wet after school, kind of learn what you want to do, kind of pick up speed, because you graduate school sometimes seeing 2 patients a day. And on a average day, Nick and I are doing 10, 15 patients when we're really busy, or in some cases, I think today I only saw like 7 or 8, but I had some really big cases. So you kind of have to factor that all in. Next is military. Obviously, multiple branches of service. Education is paid for depending on when you enlist and how you serve. You practice as a military dentist. So you have certain protocols, methods, materials that you have to kind of follow. Obviously, there's rules and you can't really bend those. But it also gives you a greater call to service, because not only are you serving the military and not only being a dentist, but you kind of have that general sense of, hey, I'm in the military, I'm serving the country. So a lot to kind of think about there, and it definitely helps with student loans. And then corporate dentistry is often a salaried position with employment benefits, and that's where you're working for a bigger corporation. But as a new dentist, it's a great way to have a salary guarantee when you don't really know what you're capable of doing yet. It allows you to kind of have that stable position, and your focus is on dentistry because the corporations typically manage the practice for you. So in some cases, a lot less risk than being out on your own or starting your own practice. Nick?
So this is the section of the presentation that's going to be a bit more like shadowing. And it's basically just trying to capture what is a daily life like for us as general dentists in our practices. In our office, we have 2 dentists, obviously, Dr. Justin and myself, and we work out of 4 different operatories, so that a person can be getting numb in one operatory while we're finishing up a procedure in another, and keep things flowing. We have 3 assistants total. They set up the operatories, they talk to the patients, they create treatment plans, they review financials with the patients, they break down the operatories, and they work chairside with us to expedite things. There are 4 to 5 hygienists, depending on the day of the week. They each have their own room and see their own patients. We have 3 front desk receptionists, and they do all the normal front desk stuff that I would never want to do, like speak with insurances and handle customer or patient complaints and those kinds of things. As Justin said, our dentists see 8 to 15 patients a day, typically. Hygienists see 6 to 8 patients a day. It's gone down a little bit since COVID, and we've made appointments a little bit longer. It used to be more like 8 solidly, but now it's definitely more like 6 or 7. And one thing to remember is dentists are in contact with almost every one of those patients. So while Justin and I each have our own 8 to 15 patients, we also have to see the 32 to 40 patients that come through the hygiene schedule every day, and doing hygiene checks and treatment plans and those kinds of things. Emergencies are squeezed in as necessary, and we also have an ACDC, which is just a marketing term for our emergency services. It's an after hours line that people can reach a dentist, and on weekends can be seen for a convenience fee. Took a snapshot today of, this is actually 2-day schedule, took it this morning. And the way I wanted to do this part of the presentation basically was to walk you through my morning. so that you could kind of get an idea of the flow of the schedule, the procedures and variety of things that were done, and get a better sense of what it would have been like if you were there shadowing with us. You can see the different colors are different procedure types. That's my first column. This is my second column of like overflow or extra things that we can squeeze in. Justin's first column and second column. And then we had 5 hygienists in the office today, so they've had a number of appointments too. A couple of cancellations today, unfortunately, but anything that's bright pink here in the hygiene schedule is new patients. So we saw a lot of new patients, which is great for a practice. Can also be a little bit intimidating if your schedule's busy, because some of those new patients will be, hey, you saw your other dentist 6 months ago and things look great. That's easy. Others are a completely trashed mouth that need, a 30-minute conversation to go through everything. And so if you're busy in your schedule and then you have to allot the time to treatment plan and talk to patients about different options and get an idea of what they want to do, then that can really bog things down.
Nick,
Part of the reason it's really nice working with another dentist.
Yeah, I was going to say, you took the words right out of my mouth. I was going to say the same thing. No, I was going to say, well, that's, as me being a younger dentist, Nick, obviously practicing more. For instance, this morning I was elbow deep in a case and had a hard time stepping out at a certain time. So I can be like, hey, Nick, can you really go see this one for me? It's something to also kind of consider when you do consider dentistry and you kind of get out in the working world. Working by yourself has a lot of responsibility and you have to sometimes be in 4 places at once. So having kind of the backup and camaraderie of another dentist is sometimes key to help make the day flow by a little less stressful.
So we'll go through my day. At 8 a.m., I had a patient in our yellow room. It's not actually colored yellow. I actually randomly assigned it because there's a blue room and a yellow room, and I never know which one's which. So I just called the back right the yellow room for the sake of this presentation. But we did a root canal on him in a previous visit. You can see the root filling here on the tooth. And then this area here was filled with the filling material after this x-ray. And now the tooth needs a crown for structural support because you can see how much of that tooth is gone. We had that on the treatment plan. I know this guy likes to do as much work as he can when he's in. Finances don't seem to be an issue. He just kind of wants to condense appointments. So this tooth back here, which already has a crown on it, you can see the bright white. Can you guys see my mouse, by the way, Krupa?
Yeah.
Okay, great. Sorry, let me go back one. So you can see some dark shadowing here underneath this crown where some decay started. So bacteria is getting up underneath that crown, causing a cavity underneath, so it needs to be treated. So I suggested we do this in the same visit. He was good with that. There's a cavity here. This one was taken care of earlier when we did this root canal, but right after that root canal, so that one was okay. So I got him numb at 8:10, and one of my hygienists came to get me to say she needed a hygiene check. So I left that room while he was getting anesthetized and went to Taylor's room. That was an easy check. It was just a recall patient, said my hellos, checked, see how they were doing, went through the mouth. No major concerns except that her jaw really popped loudly when I got in there to do my check. And so we reviewed if that's something that happens often. Is it ever symptomatic? She has a night guard that helps to prevent damage to the jaw from grinding at night, but the popping is a pretty consistent feature. So we sent her or referred her to a local guy who focuses on the temporomandibular joint and disorders there to look into that. Again, this is something a general dentist can do if you want to. Justin and I have never had a ton of interest. It's some very detailed work that's very thorough to be really good at it, and just not really something that has caught our interest. So it's nice to be able to refer that. That 8 a.m. patient in the yellow room went back in there after a few minutes of him getting numb. We cut a channel in the existing gold crown on that back tooth number 18. We removed the decay underneath. We then prepared the teeth for crowns, and you can see in this upper image the conical shape of the teeth after preparation for a crown. They're kind of tent shaped so that a crown can slide over the top when everything's restored. Then we had to achieve hemostasis, which is lack of bleeding using a chemical, because we needed to be able to scan the teeth to pick up all the details. And then instead of an impression, we do digital scans, which is why you have these images here. These are the scans taken from the machine today on this patient. Then in the software, we have to mark the edge of our preparation where our preparation stops and the gum tissue starts. And then the software proposes a crown and lets us modify it if we need to build it up, make it look a little different, create a tighter contact with the tooth next to it, reduce the bite a little bit. All those things can be adjusted. And once we're happy, we send it to a milling unit, which is pictured here, and it's all dusty from the crown that was cut out. You can see the block with the crown inside it, and the burrs that move up and back and down while the crown moves up and back to create the design that we made in the computer. And then over here, you can see this is the block we start with. Multiple materials we can use. This is the one that I used on him today. And here's the crown that came out of the mill. It comes out in this chalky appearance, and then it gets baked in a furnace to crystallize everything. This is the second crown that came out. You can see how it has the sprues attaching it still to the block. We have to break those and smooth those areas. And then it goes in the mill to bake, to crystallize and sinter, and it comes out looking like a tooth. That whole appointment takes, with him this morning, took about 2.5 hours. It's about an hour of manufacturing when we're doing 2 crowns, about 40 to 45 minutes if we're just doing 1 crown. But it's really nice that the patient can leave with the final result rather than having to deal with temporaries and having to come back to the office. At 9 o'clock, while the crowns were being made, I forgot that my car needed to be inspected and I had an appointment. So I slipped out of the office quickly. Luckily, the place is right around the corner. So I dropped that off and ran back. And I kind of, use that to illustrate, like, you're an adult, life still gets in the way sometimes. Even in a busy work day, it's nice working with Justin, and I knew he was there to cover hygiene checks if anybody needed it or whatever else. It was nice to be able to step away for 5 or 10 minutes. And 9:50, well, in between 9 and 9:50, I was working on some of this presentation while the crowns were being made and switching them over to the furnace and stuff as they were coming out. But at 9:50, Taylor got me again for a hygiene exam. He was a teenager with braces. Things look pretty good overall, but we found a sticky spot of decay on the top of one of his teeth, number 30, the surface is the occlusal. And then I jumped into our green room for 2 fillings on number 2 and number 3. And you can see the defect here where the filling is missing in number 3. Number 2, you can't see on x-ray, but it was a little bit of breakdown around the existing filling here. So we needed to replace those. I anesthetized her and then left to go do some stuff with the crowns. About 10 minutes later, I went back into the green room. I removed the decay that was there. I prepared the tooth structure chemically and then filled the teeth using a composite resin. Some, especially older dentists, will still use amalgam, the silver stuff. Some dental schools will still teach it. I don't know if it's still a component of the boards. Do you know, Justin?
It's not tested. You don't have to do a amalgam filling, but It is taught still in school.
Yeah. We don't even stock it in the office. I don't think it's a superior material, and nobody wants silver teeth anymore. So we don't need to use it. And then smoothed and polished and got her out of there. At 10:15, Sheila came and got me for a hygiene check. There was nothing going on there, so that was a quick and easy one. It allowed me to pop back in quickly to cement the crowns in that patient's mouth in the yellow room. This is a picture clinically. It's not a very good picture because I was just doing these with my cell phone to be able to pop them on here, but you can't see the decay in this tooth, but you can see the missing section here that we were filling. And then the end result's a little bit blurry, but again, got that patched in, looks nice and smooth and natural. So after Sheila's check, I ran back into the yellow room and put the crowns in place, checked the contacts with floss to make sure the food wouldn't get stuck in between, ran an instrument around the margin where the crown seals to the tooth structure to make sure that there were no gaps. Did a little bite adjustment on this guy because it was just a little bit tall for his bite. And then we took x-rays to, again, make sure there were no gaps that I couldn't see clinically. And they both look perfectly sealed on x-ray. So we cemented them in place. And now you can see he's got a new crown here, new crown back here. His teeth are so dark. We don't stock a material or a shade that would match it. Excuse me. So it does appear a little bit light. I'm not too worried about it because it's in the back and he doesn't care. And this tooth is going to get crowned eventually also. And then he's got a gold one, which definitely doesn't match. So, but at least you'll have 3 in a row that are same shade. At 10:50, because we added in that second crown in the morning, I was running a few minutes behind, not too bad. So in the green room, a hygienist anesthetized my next patient. She was there to get a little supernumerary or an extra tooth removed. And you can see it up here in the x-ray. It's just these little cusps, or not in the x-ray, in the picture, little cusps right next to the molar. A weird little thing. She came into me a week or 2 ago and just said, I think I feel like an extra tooth. I was like, yeah, probably not. I don't see anything on x-ray. And then I peeked in the mouth and sure it was. Sure was a baby tooth. And then because all of our rooms were full, we sat down a patient in our sleep room, called it the overflow room here, so that he wasn't waiting too long. just to take a peek at him, figure out what was going on. And he had an emergency with a broken front tooth, a little bit of decay. He's got a significant grinding habit that I think is the reason for the break and the reason the cavity had the ability to start. So I told my assistant what he needed to fill or take care of that front tooth. It was just the filling. Excuse me, got a tickle in my throat. And so she went and treatment planned that so he could see cost. He was a new patient to the office, so she also quoted him on doing a full set of x-rays and an exam. And then pop back in the green room at 11 to do the removal of this little tooth, and you can see what came out. Had a lot more root than I expected, but it was a cute little thing. At 11:10, about 10 minutes later, Harley, my assistant, was taking a full set of x-rays on that new patient with the chipped front tooth. He decided he just wanted to go ahead and figure out everything that might need to be done and come up with a full plan before he started working on that front tooth. This is what a full mouth series of x-rays looks like. It's 18 films, captures full aspect of all of the teeth, and includes these are called bite wings, which shows us a very straight on angle, so we can really easily diagnose cavities in between the teeth. These other x-rays called periapicals show us the roots of the teeth, but not always the most straightforward angle to actually see things going on in between. At 11:15, Justin will show you more images of this later. Justin called me in to take a peek at a crown he was having a little trouble with shade-wise. So he called in the pro. And no, just kidding. But it was actually a very tricky case. You can see these three teeth are all, four teeth really are a little bit darker. These are a little bit darker. This one's a little bit lighter. This is the crown Justin made. This crown matches almost perfectly with all of the other teeth except for this one. And so it was a very difficult balance to figure out, do we want this to match with everything else and not that one? Do we want these two to be the same so it's at least symmetrical and then those two won't match with everything else? So it did take some discussion, and this is kind of like the artistry of dentistry. It's kind of entertaining to see how to get around those issues. At 11:20, again, another good reason to work with somebody. You have somebody to bounce ideas off of. You've got a little backup. It's nice to be able to have a conversation rather than be stuck on your own. At 11:20, I did another hygiene check in Sheila's room. It was a new patient. Didn't have any decay, but this patient had periodontal disease in the past. Naturally just built a lot of plaque and tartar. He had missed a couple of recalls because of COVID. So she got him cleaned up today, removed all the bulk deposits, but since we're playing a little catch up, she scheduled him again in 4 to 6 weeks to follow up and make sure things were looking better. His gum tissues looked healthier and there wasn't any calculus or tartar that she had left. At 11:30, I went back in the room with the guy who had the chipped front tooth. And you can see the chip right here with the shadowing behind. That's the cavity. On the other image, sorry, I have to keep shrinking my screen here. On the other image, you can clearly see the decay. And the same thing is starting here and here. You can see all the chipped edges. You can see the worn edges where you should have stronger contours or angles. Same thing down below here. That's due to that grinding habit. So I went through his full series of x-rays. I did a clinical exam on every tooth. There really wasn't much else. There was a little cavity in the back here. We've got the 3 up front here that we're going to fix. But we did talk about the grinding issue. And, I said, we definitely want to consider a night guard for you. We want to do those fillings first because they're going to change the shape of your teeth. And we need to make sure that whatever we make night guard wise is going to fit the final shape. And then I brought up whether or not he snored or whether he's been tested for sleep apnea. And his answer was, I definitely have a problem regarding sleep apnea. And this is something Justin and I got into a few years ago, treating sleep apnea. And so I said, listen, let's get those fillings done. We'll bring you back. We'll do a cleaning that same day. And while you're here, we're going to run you through our sleep apnea screening process. He's like, really? I can do all that here? Man, this is awesome. And so, that's one of the nice things about general dentistry. You really can provide as much as you want for your patients. And patients don't like leaving and going places and meeting new people that they don't necessarily trust. You earn their trust. They want to stay with you. So he was thrilled to hear that we could do sleep tests. We could do treatment if needed. We could do all of this in one visit. So he's not coming back multiple times. He really appreciated that. And then 11:40, I worked on these presentations until I had parent-teacher conferences taking up my lunch hour at noon.
Cool. So my morning, I don't know, from all the way back from our schedule earlier, I basically had one patient that took up the majority of my morning. So this woman came in for a root canal. So her tooth was infected. She called us last week saying that it was swollen and a big infection was going. So I numbed the area up. I went in, I actually accessed the nerve of the tooth, disinfected the inside of the tooth, filled it back up. And then you can see in the first image there, after I filled that tooth back up, you do that crown prep. So you take about 1 millimeter to 1.5 millimeters off all the way around the tooth. Kind of creates, like Nick called it, that tent shape, that kind of peg essentially. Then using the digital software, the cool thing with this one is her tooth beforehand actually looked good despite having an infection and a cavity. So I was actually able to take a copy using her existing tooth. I was able to scan it before I touched it with a drill so that when I made her this new one, it's exactly like her old tooth in shape. So there's no guessing, there's no double checking like, oh, is this going to look good? Is it not? It was the same tooth she had. So there's no way she wasn't going to like it. Then the hard part came in, and then you can kind of see the arrow there pointing at that tooth is the shade. You're doing a lot of dentistry. You're staring at this tooth for 2 hours this morning, doing a root canal, doing the filling, doing the crown pep. And then you're figuring out the shade and you're like, well, it looks good with the majority of the teeth. And then sure enough, you make the tooth and it's close, but it's not perfect. So that's when you kind of look at something long enough, you kind of get lost in it. You see colors, your teeth, you're looking at white teeth and you're like, I don't even know what's white, what's not anymore. So that's when it's nice to have somebody else be like, hey, Dr. Nick, come take a look at this. So the good news is she's coming back tomorrow and I have the ability to take that off because I temporarily put it on there and I'm going to customize it. So basically, much like you do a painting, you're going to put some stain and glaze to try to blend it somewhere in between those two teeth, hopefully find a middle ground that she likes. And more importantly, I like, because a lot of times I'll put a tooth that looks like that in a patient's mouth and they think it's the best thing they've ever seen. And in the back of my head, I'm like, it's 80% there, but it's not quite perfect. So you kind of have to find that balance of being too much of a perfectionist, because sometimes the patients, they do not care whatsoever. And you're the one that actually cares. So you kind of have to find that like, hey, you know what? They could be ecstatic with this. Well, you're in the back of the head saying, I could make this better. They might not care. So you have to also figure out what a patient wants, because they may say that's the best looking tooth in their entire head. And you know what? You don't want to necessarily tell them they're wrong, because they might be proud of that tooth now. So I didn't do the exact kind of clock countdown that Nick did, but I did have fillings that were supposed to be there in the morning. They unfortunately called forgetting that they had a dental appointment 5 minutes before and said that they weren't able to make it. So I got to spend time kind of customizing the tooth a little bit more. And I made actually a spare one for tomorrow so I can try 2 in and see which one looks better. But in the meantime, I did 6 or 7 hygiene checks. I think 2 of my patients one of them actually had a cavity on almost every tooth in the mouth. So it was a pretty big treatment plan. It took maybe 15 minutes to sit down, figure out what was going on, sit down with the hygienist and the patient and say, hey, this is what we need to do, A, B, C, D, in order to get you healthy. And a lot of times it takes that conversation to motivate a patient, because you tell someone, hey, you've got 15 things that need to be worked on. Their mind kind of goes blank. You kind of see them just staring off past you and you're like, hey, we got to motivate you. So a lot of what we do too is kind of patient motivation. You have to help them get ownership of their own mouth so that they want to fix it up with you. And then we can't obviously follow them home to keep their teeth clean, because this tooth may look great, but if she doesn't brush it between now and the next time I see her in 6 months, she could start getting cavities around it. So really, you got to make sure that you kind of help our patients and help your patients eventually learn that, hey, you know what? The ball's in their court. You can do the best dentistry in the world, but if they don't take care of it, it's not going to last. So you have to have these kind of conversations throughout the day. And I think a couple of the other hygiene checks that I did were pretty straightforward. I mean, maybe a small filling here. Some of them are perfectly healthy, and you pat them on the back and tell them they're doing a good job. And patients love to hear that, because when they are, that reinforces that kind of, hey, you know what? I'm doing what I need to do. Let me keep doing what I'm supposed to, so that they can kind of, so to speak, like own their mouth and make sure that they kind of have some pride in what they're doing.
I want to go back to a picture of our schedule. Really just to illustrate how, we went through those specialties and it really does apply. So here Justin did a root canal, that's endodontics. He did an anterior crown, which is cosmetic, obviously, as we talked a lot about the shade of that thing. That could be considered prosthodontics for sure. I did an extraction here, even though it was that little mini tooth, it was still an extraction, and we do much more difficult ones than that. It's oral surgery. We did some bread and butter dentistry for sure. Here I was delivering a denture. It's not pictured here because we added her in later, but I was actually repairing a hybrid appliance, which is all the teeth come out and are replaced by 4 or 5 or 6 implants. and a denture that's fixed to the implants that is held in by screws and the patient can't remove. That's definitely prosthodontics. There are not that many general dentists that do it. Very, very few here in Charlottesville, but I really enjoy them. Here is orthodontics. She was finished with treatment and we were giving her retainers, but we do orthodontics. And here was a little bit of light TMJ work. It was a patient that was having pain from clenching and grinding. So, I mean, huge variety just in today's schedule, and that's literally just today. So it's really nice to be able to get that variety on a day-to-day basis. You have anything to add to that, Justin, while I find the next slide?
No, I mean, I think that's kind of the beauty of dentistry is no 2 days are ever the same, because not only does kind of the specialty or the type of dentistry that you practice, but to kind of go into what Nick's, I think, going to be kind of talking about some too with daily life considerations is patients are also different. So really, you kind of wake up not knowing what the day is going to look like aside from what a schedule is supposed to look like, but you may go in there and you never really know. And it's fun. So it's not like you're working a desk job or something where, you know, it's just the same old every single day. It's always changing. So.
Yeah, as Justin said, you know, obviously our primary goal is doing good dentistry every day. But there's a lot to consider in doing good dentistry to make sure you're doing not just quality dentistry, but also the dentistry that patients want, that they can afford, that fits in their values. So patient management every day, every single patient is always something new. Some are very anxious. Some want to save every tooth no matter how bad it is, and some want to save no teeth no matter how good they are. Some can afford whatever treatment you want. Like I said, that guy this morning needed another crown, doesn't blink at another $1,200 added to his appointment. Sure, we'll get it done for him. And others can't afford the extraction that they came in for that day for $150. That's a lot of change. Medical history is an important factor. You don't want to ever endanger your patients by doing something that's not safe, contraindicated with medications they're taking or conditions they have. So it's getting to know every individual that comes in your office enough that you feel confident making recommendations for their health. And that's a big responsibility.
Nick, I was going to add to that. For instance, this afternoon, I had an interesting afternoon. One of my patients fainted as soon as I did the injection. So you have to immediately kind of react, be able to get them in the Trendelberg position, lift their feet up above their head, get the blood back, and then kind of coax that patient who's going to be highly anxious, knowing that they just passed out. They're also a little bit embarrassed because they passed out because of a needle. And then figuring out, how can I keep you comfortable? Is this going to happen every time we do an injection? What can we do to help prevent things like that? You never really know. So definitely kind of spices up the day just a little bit.
I'm pretty certain that the fainting was due to your overwhelming charm, not the injection, but yeah, you know. Staff management's an important feature every day. I mean, especially if you're the owner and then you are also HR. You got to assign duties. You got to make sure people get along. You got to make sure jobs getting done properly. You got to manage your schedule. Some dentists want to be super busy, double booked in 2 columns all day long, and others barely want to work. And you have to make that decision. What kind of quality of care do you want to give your patients, and what kind of pay do you want to take home? Reimbursement's an important thing, especially as an owner. Do you accept insurance? Do you go fee for service? Do you have any in-house plans or financing? You know, you're going to present these multi-$1,000 treatment plans. You've got to make sure that there's a way for patients to be able to do them. Making sure your practice is constantly growing and you're building it. That means meeting with reps for marketing, for technology, for efficiency. There are plenty of consultants out there. You got to evaluate closely your return on investment for anything you're buying. I mean, there are a billion things to spend money on, and people send me emails and make phone calls, just cold calls out of the blue, just trying to get my money somehow, and really making sure that you're making wise investments is pretty critical. You have to do CE, required 15 hours a year here in Virginia. And you got to stay on top of things, making sure that you're up to date and aware of what's going on in the new world every year. And then self-health is a really important factor that nobody really mentions in dental school. Dentistry is not easy on your body. You're in a pretty compromised position with your head forward and shoulders slumped, and you got to make sure that you take a minute out of the day to kind of bring everything back and straighten up, and make sure you take care of yourself, exercise at night or whatever that is, to make sure that you stay good to go for years to come. As an owner, Justin touched on a little bit of this earlier. You are HR. You got to handle hiring, firing. You have to handle conflict resolution among staff members. You got to process payroll. You've got to do all those day-to-day administrative things. You got to balance books. Thankfully, I have my wife who does that for me. Business operations like licensing, taxes, insurance, you've got to make sure all that is set up and you are protected and keeping up with your responsibilities so that government doesn't come after you or something disastrous happens. Financials, I mentioned that. Reconciliations of accounts, setting budgets, making sure you have money to pay your staff. Marketing is a big one. Again, that's a big ROI thing, making sure that you're making good investments. There's a lot of ways to waste money in marketing. There's a lot of ways to spend it well. For our practice of 2 dentists, we spend, I want to say $4,000 to $5,000 a month in marketing probably. And I think we do pretty well with that, but it is interesting. It's one of my favorite things. Just as an example, was it last year, Justin? When we really were trying to target families, specifically women, because they tend to be the decision makers for a household, with young families to, get people that are going to be part of the practice for a long time. And I know our marketing was successful because every one of our new patients was like 25 to 45 years old.
And perfectly healthy.
What's that?
And perfectly healthy.
Yes. And it was a big issue because we were not finding any work to do. Our marketing was super targeted. It worked really well. It was bringing in tons of the people we were trying to target. And yet all of a sudden, Justin and I were like, yeah, it's like 6 hygiene checks and I haven't found a single cavity. So it's interesting to really evaluate what you're looking for, what you're trying to bring in to make sure that you are feeding the practice the way it needs to be fed. Interestingly, you learn none of this in school. You learn dental techniques. You know nothing about running a business when you get out. So the key to my success as I got out of school was knowing good people. Having an accountant that specifically does dentistry and could walk me through these things. I mean, he knows national averages for everything. The budget for the amount you should spend on stamps as a percentage of your total production. I always know if I'm above that, below it, right where I should be. A good attorney to set up contracts and to set up transition documents, and a good insurance guy to make sure that you're covered from a malpractice standpoint, but also if you own the business, make sure you have the right business overhead, disaster insurance, payroll insurance. I mean, there's so many things to consider that even now, I know I don't know it, and I have no interest in knowing it. I don't make any money off of knowing it. It doesn't make my life better to know it. That's why I hire people. You know the right ones and you'll be set up well and makes your life a whole lot easier. Justin touched on this again a little bit earlier, so I'll fly through it. Benefits of ownership. The big one is high potential income, but you really also make your own schedule. You don't have anybody to answer to. Those are things I really enjoy. I really hate some of the administrative tasks. My wife does the books. Thank God I have her because I hate doing that. It also makes relationships tricky. And Justin can speak to this a little bit because, the staff views him as a manager, but it's difficult to balance the boss as a coworker relationship because we work literally knee to knee, if not closer, with some of the assistants and some of the staff. And so you know a lot about their families. You talk to them on a daily basis. It's not like you're in an isolated cubicle and they're in their own cubicle and you're just a supervisor. You are in there. So you're friends, but you also can't cross that line because you still need to have authority and they need to respect you and everything else. And that's a difficult relationship to manage. It's hard to find the right balance. So it's another day-to-day consideration for sure.
I think another thing to kind of touch on there too, Nick, is when you graduate dental school, depending on how early you go in, I graduated at the age of 26. So you're a 26-year-old doctor. Some of the staff that we had at that point in time were in their 30s or 40s, and you're technically above them. So being in a position also is kind of tricky when patients come in and ask me if I'm 16, me bossing around somebody who's been practicing dentistry as a hygienist, for instance, for 15 years. It's also kind of a tricky situation because you have to be that coworker, you have to be an authoritative figure, but also not necessarily have the experience in anything that Nick's talked about because they don't teach you it. So it's definitely another kind of aspect of that relationship that's kind of interesting to see.
Well, in brief summary, dentistry can be fun, can be rewarding. Go be a dentist. Just don't do it in Charlottesville and compete with us, please. Do you have anything to add in closing?
No, I mean, really, I like to kind of tell patients there's days where I come home and there's nothing that I'd ever want to do different besides dentistry. And there's days where you come home and you're like, man, today sucked, but I'm excited to go back to work the next day. So you really have to find something that you want to do. And in this case, dentistry works for Nick and I. And I mean, it's fun. You got to look forward to the next day. And kind of to touch on what Nick said, you're always learning too with those CE credits we have to get every year. I'm a big nerd. Nick can attest to that. And you don't stop learning and you don't stop practicing. And don't practice in Charlottesville, but be a dentist.
Krupa, obviously we don't have a question and answer option here. Do you have any questions that you know were broadly wanting to be addressed or anything?
Yeah, well, first I want to say thank you so much for the great presentation. I really enjoyed going through your morning and seeing all those different procedures that you guys do.
Yeah, thank you so much. And also bringing up, like the business side of dentistry, because that's not something that's like talked about a lot, through these presentations. So I'm going to go ahead and read the questions if that's fine with you guys. We have about like 10 minutes.
Of course.
Okay, cool. So I think this first question was for Dr. Nick, if I remember correctly. And it goes, would you say that majoring in engineering helped you become a more competitive applicant? Also, how would you say engineering and dentistry compare? What do they share in common?
Well, yeah, this actually is a question that probably both of us should answer, not directly the engineering thing, but just how to approach academics in general and dental school. Justin and I have very different academic philosophies. Come college, I tanked as a student. I just couldn't care anymore. So engineering was pretty easy for me because I'm good at math and I enjoyed that kind of stuff. So, and it was something for me that I wanted to do because if I didn't go into healthcare, I knew I would enjoy the job and I knew I wouldn't be stuck in a cubicle. I could be out on job sites and, kind of enjoying life a little bit. How it's helped me specifically for dentistry, I don't know that it has. In any broad way. I think that I have a little bit better sense of failure of materials and structures for sure. But I don't know, maybe I just kind of shortcutted getting there. I don't know that, Justin has any less knowledge of that than I do. I think maybe I just picked it up a little or had more of an intuitive feeling for it in dental school. What would work, what wouldn't work, where things need support, where they don't. Properties and behaviors of materials, some engineers know a lot about that, can certainly help you here, but really a lot of that is not super helpful unless you're stuck in academia of dental school. A lot of day-to-day practical dentistry and private practice is working with your hands and really working with patients. And engineering doesn't have a whole lot to do with that. So I liked it. I thought it expanded my brain. And that's why I studied all the other things I did too, but I don't know that it had a huge connection. I'll tell you, it's a hassle because I had to take a lot of extra classes to get done the requirements. It's not like it was part of my curriculum, but it was worth it. I enjoyed learning it.
Nick, I'll add to that. So I worked with the admissions at UNE a little bit, as well as a bunch of my friends in my class did as well. And you have to think everybody that's applying to be a dentist and go to dental school, they've all got good grades. They've all graduated with a good GPA, a good DAT score. They've got some extracurriculars. So really it's kind of giving yourself a little bit of variety. And after you kind of talk to the 10th, 15th, 20th bio major, it's kind of refreshing to be like, oh, wow, you studied something else. I mean, I know in my class, I had everything from English majors to engineers to, I think, fathers of 3 who were English teachers or PE teachers who were like, hey, you know what, I want to be a dentist, and came back to school. So really having something that kind of stands you out. I think engineering necessarily isn't the answer, but it definitely isn't the normal traditional route, and can maybe give you a little edge in that way.
I think if I had to make a recommendation, I would say maybe not as your major, but study things that give you the ability to think on your feet, that give you the ability to analyze, because especially if you want to be a business owner, it's very important to be able to reasonably analyze, and give you the ability to speak to people, present to people, read people. Those are really the day-to-day skills that we use a ton, whether that's engineering or whatever else.
Thank you so much. That was interesting. The next question is, when finding a partner to open a practice with, what tips would you recommend? Would you recommend finding someone in dental school?
Finding an associate and finding a partner are very different things. Finding an associate, they're both important because the associate represents your practice. It has to be somebody that you trust. Has to be somebody that you know your staff is going to get along with. Has to be somebody that you know your patients are going to get along with. I mean, they are an extension of you, and are going to be really key in making sure that the practice can work. I don't know why I've stuck with Justin so long. Yeah. Having said all that, but no, he's been great. I mean, he fits that bill, and you know, it's important to me that he sticks around in the long run because I don't want to have to go find somebody else that does that. It's not easy. I also enjoy working with him and talking to him every day, so it makes life easier for me. Finding a partner is like getting married. You are then contractually bound. You know, if I hated Justin, not that I would want to, but I could just fire him and move on to somebody else. But if Justin becomes partner and we did that too early and we realize all of a sudden we're not compatible, that becomes a big deal. So I think in terms of partnership, it's very important to spend time. Don't rush into things. Make sure you're going to be comfortable in the arrangement. Make sure you're going to be comfortable with the person because it is like a marriage, and divorce is not easy. So it's definitely take time, get to know people, get to make sure you can trust them.
I think also coming from my position being a little younger grad, as far as I've got some great friends from dental school and they're fantastic dentists, and I would travel to go let them do some cosmetic work on me because they do some incredible stuff. But on the flip side, I don't think I'd ever be able to practice with any of them because we might have different business philosophies and you don't get taught a lot of that kind of non-dental things in dental school that you don't know if you're going to work well together. Yeah, you might be able to drill and fill a tooth the same, but how's your days going to flow? This and the other, you don't really know until you work with someone. And I mean, like Nick said, he could fire me today, but from working with him this long, it's like, hey, I can see Nick and I agree on this, or we disagree on this, but we can get past this, that, and the other, and we build off one another. I know that we could have a good partnership. But if there was someone that I constantly headbutt heads with, you wouldn't necessarily know that just in dental school, just by being in classes with them or this, because you don't know how they are in business, how they are in practice. And it may be good to know, hey, you know what, I've got a couple friends that I'd consider down the road, but nothing that you want to get married to right away, potentially.
To answer the part of the question about would I find somebody from dental school, as a business partner, hell no. They need a little bit of experience under their belt to understand what goes into running the business. And you need to see them in a decision-making position to know whether or not you would agree or at least be okay and be able to accept the types of decisions that they would make. As an associate, I've had 3 associates and all have been straight out of dental school. And I've worked with I have another associate who I bought the practices from. And I think dental school people are great. There's typically a little bit of a speed difference right off the bat and some learning. But as long as you're willing to take that and help form the person that comes out, they always need a little bit of mentoring. I think it can work out well. Again, it's more personality, I think, than anything. If you come out of dental school, I assume you're competent, and unfortunately, that's not always true. But a lot of it, again, is personality, just knowing that you're going to have a similar philosophy and you're going to get along with the right people.
Thank you. So what are your thoughts on corporate dentistry versus private?
There is such a wide variety of corporate dentistry that's really hard to answer. There are some that are mills, basically. I mean, they just churn out work. They hire associates straight out of school, keep them for a year or two. Those associates move on because they're tired of just being grunts. And there's not really that focus on patient education. They're more factories and they try to sell. Then there are some that are essentially groups of independent private practices run under the same umbrella, but the private practices keep a lot of their original character. They'll keep their same trade names. They'll keep the same doctors on, and they have a lot of autonomy. And I think those things can be great. I think it allows for different flexibility for the owners and the practicing dentists to not have the administrative responsibilities. Some of those responsibilities can be very distracting and time consuming. And so if the dentist can focus on the other things they want to do, that can be a really nice lifestyle. I think it's nice to have the resources that a lot of those groups can have in terms of CE or team building or technology because of the extra finances. I think there are definitely pros and cons. I think in order to decide what you want to do, you got to be out there and practice a little bit. So I think evaluate every opportunity. Never say no until you've heard the presentation.
Alrighty, I think that'll be our last question since we've hit 7. But I wanted to say thank you so much again, Dr. Nick and Dr. Dustin. That was a great presentation, very informative. And thank you everyone for watching. I hope everyone has a great night, and we'll be putting the quiz link, attendance quiz link, in the live stream chat. So, all right. Bye, everyone. Thank you so much for watching.
Good night, guys.
Thank you all.